Breast Care Center is a leader in innovative breast-conserving surgery, including an advanced surgical technique known as Oncoplastic Surgery, which combines the techniques of both oncologic surgery with plastic surgery. Surgeons skilled in this complex surgical approach are not only able to successfully remove the cancer, but also preserve the breast, often making it look better than before surgery. And this is achieved without the use of implants or artificial tissue, but through the knowledge and skill of the surgeon utilizing a woman's own breast tissue.
Normally, if you take a large piece of tissue out and simply close the wound, you're going to get a deformed breast and an unhappy patient. Oncoplastic surgery uses preoperative planning, discussions with the patient to figure out what's the best way to take this tumor out, get the widest margins, and to reshape the breast while we're there. This requires moving tissue from one part of the breast to another, and very often it requires changing the size and shape of the other breast. Most patients who have oncoplastic surgery are incredibly happy with the cosmetic results, but even happier with the oncologic results, because almost always it succeeds in getting out the tumor with widely clear margins, allowing us to preserve the breast.
Although there are some women who may not be candidates for oncoplastic surgery, the good news is most are.
A patient's breast size, as well as the area of abnormality, come into consideration when planning an oncoplastic surgical procedure. And by identifying the area of concern and what breast tissue is going to need to be removed, we're able to employ different techniques to offer a woman excellent cosmesis and a great oncologic result as well.
In addition to oncoplastic surgery, Hoag Breast Care Center is committed to providing women with a full range of state-of-the-art, evidence-based, best practice breast care, which is why Hoag's multidisciplinary team meets weekly at the Hoag Breast Cancer Tumor Board.
One of the unique facets about the Hoag Breast Care Center is that we do offer a multidisciplinary team in determining what's going to be the best breast cancer care that we can offer a patient. We do have weekly breast tumor boards, which offer opportunities for our breast specialists, including breast radiologists, pathologists, medical oncologists, surgeons, radiation oncologists, plastic surgeons, and our genetic counselors, an opportunity to present cases and offer input from various fields pertaining to an individual. In this fashion, we're able to really tailor a patient's care in order to meet that patient's cancer needs.
At Hoag, we pride ourselves in a multidisciplinary care system. And what that means is that the patient isn't bounced from one doctor's office to another doctor's office over a number of weeks in time. At Hoag, the entire process is streamlined down to a day or so. And here's what happens. An abnormality is noted on an x-ray. Additional studies are done right then and there, and these might include ultrasound or an MRI. And generally the same day that we find an abnormality, a biopsy is done. And then 24 hours later, we've got the results of that biopsy. That patient is back in to get the results, and then Hoag has a surgeon available for right there that day. So in the space of 24 to 48 hours, this patient's gone from not knowing anything to knowing exactly what she's got and having a direction and a plan for the future. And then all other appropriate consults can be brought in, such as medical oncology, radiation oncology, or plastic surgery. Whatever we need to do, it's at our disposal, and we can do it quickly.
One of the key assets within Hoag's multidisciplinary team is its nurse navigators. These caring, knowledgeable, and compassionate clinical nurse specialists provide one-on-one consultation and educational support by offering a wealth of information and resources for women. This type of personalized support is a unique facet available at few medical centers, but one that brings knowledge and comfort to Hoag patients.
Now, while the woman is going through this complex process of seeing multiple doctors, she's accompanied by a nurse navigator who who is like her concierge, who gets her through everything, who explains everything, who calms her down, who answers questions, who really is her pal as she goes through this, but is knowledgeable and is an extra pair of ears for her.
When it comes to sorting through the next steps after a breast cancer diagnosis, there are many more choices today, so it's important for women to make an informed decision as to the type of cancer care that is best suited to their unique situation.
30 years ago, when we felt a lump, we had that woman in the operating room the next day, and she ended up with a mastectomy the next day if it was cancer. And today, that's absolutely incorrect treatment. The first and most important thing to understand is that cancer is a chronic disease. It didn't occur yesterday. It took years to get to where it is. Even if it's a small, tiny cancer, it has probably been there 3 or 4 years. So if it's there 3 or 4 years and a day, or 3 or 4 years and 2 weeks, it doesn't make any biological difference. And what that really means is that the patient has time to figure things out, to get all of the opinions that she needs. She does not have to rush to try to go to the operating room and get definitive treatment tomorrow. She has a few weeks to get second opinions, to, particularly if a mastectomy is advised, to make sure that that's what she really needs. To see a medical oncologist, to see a radiation oncologist, to see 2 or 3 surgeons if that's what she wants, to make the right decision for her. And it's always good for her to bring a friend or a spouse with her so that she has an extra pair of ears, because sometimes it's pretty difficult to hear all of these things in the space of a 1-hour consultation.
When making a decision about where to receive your breast care, it's important to consider the expertise of the physicians and hospital you are considering. Hoag Breast Care Center's dedicated team of fellowship-trained breast surgeons are not only experts in oncoplastic surgery, they also serve as mentors to other surgeons, helping to train more physicians in the highly specialized field of oncoplastic surgery.
Hoag is a leader in oncoplastic surgery, and one of our goals is to take that knowledge and disseminate it throughout the United States. Right now, we're in the process of making an oncoplastic video that will be used to train surgeons all over the world. And specifically, we train breast fellows here, and those fellows leave Hoag and start practices either in this part of the United States or somewhere else in the United States. We've trained now more than 20 fellows, and they're in New York City, they're in Atlanta, they're in Boston, they're in the Midwest, and they're out here in Southern California. In fact, they're all over the United States. And every year we continue to train 3 additional fellows. And I think one of the legacies that we'll leave behind is that we will have trained hopefully 100 fellows by the time this process is done. And they will be practicing all over the United States, and they can put their hand up and say, I've been trained partly at Hoag. In terms of oncoplastic surgery, Hoag really is the center in the United States right now for it. We think about it all the time. We offer it to virtually all patients, and we train doctors to go out and do oncoplastic surgery. It's not widely available in this country yet because we haven't trained enough physicians. The USC Hoag Fellowship is the only breast fellowship that specializes in oncoplastic surgery. Typically, we get 40 applicants for 3 spots, and we fill those 3 spots, with the first 4 or 5 choices, the spots are filled. So this is a place that people want to come, both patients and breast fellows.
For more information about Hoag Breast Care Center, please call us at 949-764-5780 or visit our website at www.hoag.org/breastcare.